Hello out there in television land. Welcome to yet another edition of It's Your Health, the fastest 30 minutes in television history. I'm here with my bride, Kathleen, and we're going to bring you the latest and greatest in healthcare information. Right, sweetheart?
Absolutely, sweetheart.
What a perfect wife. We'll be right back after this brief commercial message. Remember, you're watching It's Your Health, your leader in healthcare information. Please check with your healthcare provider before doing anything that we talk about here on It's Your Health. We'll be right back. Welcome to the first segment of It's Your Health. Philip Benyo with my bride. And before we start, I have to put a shout out there to one of our faithful listeners. Her name's Marie. Marie, you know who you are, and your sister and herself watches It's Your Health even at 2 in the morning.
Oh, thank you.
We take care of Marie's husband at a nursing home, and she loves particularly when you give me a hard time.
Oh, and it's easy to do.
Marie, it's not only on the set. At home, it's the same way. I am in a living hell, believe it or not.
Don't believe it for 1 second.
Well, now that that's out of the way, maybe we can progress.
Well, now you've set the theme for the whole morning.
The living hell.
Mm-hmm. Let's do some headlines instead.
All righty.
See how much you know from being in that living hell. Can diet help with symptoms of an enlarged prostate? This is our first headline. The risk of an enlarged prostate increases with age. By age 60, half of men will have it. And yes, making some healthy changes to your diet and exercise may help you manage symptoms.
About half of men at the age of 60 have an enlarged prostate. Low-fat diet will help. Getting rid of some belly fat will help. Don't forget vitamin C and zinc. They also can prove useful. But I think it's more important that you get your prostate checked, you get your PSA, you get a digital rectal exam, because unfortunately it may be other symptoms other than an enlarged prostate.
Oh boy, that sounds like fun.
It's not.
It's a living hell.
That's right.
Headline number 2. Is it true that smoking causes wrinkles? Well, of course we know the answer is yes. So if you need another reason to motivate you to quit smoking, add premature wrinkles to the list. But smoking doesn't cause wrinkles only on your face. Smoking is also associated with increased wrinkling and skin damage on other parts of your body, including your inner arms. While the skin wrinkles may not be reversible, you can prevent worsening of wrinkling by quitting smoking now. 4,000
chemicals are in one puff of cigarette
Wow.
smoke. That's quite a bit, and most of them are dangerous and create cancer. Because nicotine will constrict the blood vessels, those blood vessels won't go to certain areas of your skin, and of course they'll wrinkle. And people who smoke may often squint and purse their lips, which adds to the wrinkling phenomenon. So
that's what they say about people who use straws, that straws cause wrinkling around your mouth the same way that cigarettes do.
Didn't know that.
I don't know if that's true or not, but that's what I read.
If you say so, then it's true.
It's a living hell.
That's right.
Headline number 3. What does it mean when urine looks foamy? Oh, this is a good question. Passing foamy urine now and then is normal, for the speed of urination and other factors can influence this. But you should see your doctor if you have persistently foamy urine that becomes more noticeable over time.
Yeah, it's an interesting question. When someone tells me that their urine is foamy, the first thing we think about is protein in the urine. That can add to foaminess. Protein in the urine is not normal. You should have no protein. So if you are spilling protein in your urine, it could be from diabetes, hypertension, or some other issues. So you need to bring that to your physician's attention.
I guess I should get that done, huh?
Your urine is foamy.
No, my urine's not foamy,
Oh.
but I haven't had a urinalysis. People should have that regularly, shouldn't they?
As part of, yes, diabetics often get urine tests yearly, and hypertensive is the same. We're talking about patients who have symptoms of foaminess. But yeah, urinalysis is kind of part of a general exam.
Okay. Oh, this is the topic that it goes along with the topic of fall. Flu shot, your best bet for avoiding influenza. This year's annual flu shot will offer protection against the H1N1 virus, in addition to 2 other influenza viruses that are expected to be in circulation this flu season. A vaccine that protects against 4 strains of the virus will be available, as will a high-dose flu vaccine for adults age 65 and older.
Yeah, now's the time. I always preach when they're flirting with playing the World Series, you ought to get your flu shot. That gives you maximum protection for when it's needed the most. Keep in mind there is a high-dose flu shot out there if you're over 65 that we've been currently giving. And I have to say we have not had any reactions to speak of from people getting the flu shots, because we often hear, well, I get sick after getting it, but we have not heard anything.
How long does it take to build up immunity after you get your flu shot?
Yeah, generally around 2 weeks. So that's why you want to get it now instead of waiting till Christmas to get your flu shot, because that's typically when we start seeing flu-like symptoms.
And are the flu shots the same as the flu shots from last year?
No, they change from year to year depending on how that flu virus has changed its first and second name.
Oh, so they even change its name.
You're right. Last year's flu shot would not necessarily help you this year.
Here's someone who called in a concern. My 24-year-old husband has started to wet the bed at night. What causes adult bedwetting? Should we be concerned about this?
Well, of course, you should be concerned, and the list is kind of lengthy. If you look at your television screen, you'll see some of the things that we would be concerned about. You could have a blockage in the urinary tract system, like a stone. You could have overactive bladder nerves. You could have diabetes. Medication side effects and neurologic issues can also do that. Infection is very common, and so is, believe it or not, obstructive sleep apnea. So if you're an adult and you're bedwetting, male or female, I would look at this laundry list and try to sort it out.
Okay, and that's another reason why you have to change your sheets.
Oh, yes, that's another good reason. Absolutely.
And so we'll be right back with more information and more exciting news and
more living hell. Be right back after this brief commercial message.
Oh, sure. You can see he's living in hell, sure.
Welcome back to the second segment of It's Your Health.
And you know, it's a beautiful day. It's a gorgeous fall day. It's not a living hell.
Okay.
We're lucky to be enjoying such beautiful weather and sunshine and blue skies and colored leaves.
Yes, yes, dear.
What could you have to complain about?
Nothing. I have a perfect life.
That's a much better answer. That's
Very.
Exactly what you have.
Sweetheart,
A perfect life with a perfect wife.
the public is awaiting
All right.
our
Headline number 1. I've been seeing ads that say caffeinated drinks hydrate you as well as water does. Is this true? It's true that caffeinated drinks can contribute to your daily fluid requirement. While caffeinated drinks may have a mild diuretic effect, they don't appear to increase the risk of dehydration.
Probably not. There was a concern about coffee use, having caffeine or caffeinated beverage. It is a mild diuretic, but it's not enough to produce clinical symptoms of dehydration. I don't think it's an issue.
Well, that's good, because they used to say it was an issue. And this one is an issue. energy drinks. What are the health risks? And there are many. Caffeine can cause major health conditions, including problems with heart and blood vessels. The number of energy drink related emergency room visits doubled between 2007 and 2011, especially among people under the age of 40.
Well, these energy drinks are packed with all types of chemicals designed to give you a kick in the rear end, if you will. And you really don't need them, quite honestly. We need to find out why you need the energy drink to begin with. But excessive caffeine and those types of things, they are drugs, and they can have healthcare side effects. So I think I would avoid them.
Oh, I would think so. Okay, next headline. Hate UTIs? One simple step can cut the risk. Drinking plenty of water each day may have an unexpected benefit, staving off urinary tract infections. The water also reduced the use of antibiotics by roughly half.
Well, women particularly should take note because they generally get urinary tract infections more than men. And water obviously would be something that promote urine from building up in the bacteria, which may, in the bladder rather, but it may explain why our elderly often get frequent urinary tract infections. They don't drink, they're camels, particularly if they're in a personal care home or a nursing home. Their access to free water or fluids is limited, so you really got to push the fluids to reduce your risk of
well, that's not
urinary
good.
tract infection. That's not good.
Our next topic is a serious topic. Sexual dysfunction in women. Can we talk about it? Sexual dysfunction in women is common and often goes unreported and untreated. Sexual dysfunction is complex and multifactorial and has a significant impact on the quality of life.
Oh, there's no doubt. And not too many people come down and on their laundry list of things bring it to my attention for whatever reason. But it's out there, and it certainly is something that is the elephant in the room. Probably the most common symptom, if you will, out there is that the women don't care anymore or don't care whether they have sex. And that has a variety of issues as well. Because men generally are ready to get in the batter's box.
Anytime, any place. It's not a living hell then, is it?
No, it isn't. But get a load of this list while we digress, or digress. Get a load of this list of things that one often thinks of when they're talking about sexual dysfunction. And this is generally regarding women. There are biological factors such as medications, hormonal status, your physical health and aging. There's psychological factors. If you're depressed, you're anxious, you have self-image issues, you have substance abuse, or if there's been a history of trauma in your life or abuse. It often depends on your religious background, your upbringing, and what you expect of yourself. And there are interpersonal factors. You know, you have a partner that you enjoy having intimacy with. So the list is
you?
Yeah. Notice it was singular, not plural. But yes, the list is a mile long, and it really is something that needs to be talked about. And when a person comes down and they expect us to see them for 10 or 15 minutes and squeeze all of these things in, it often is dropped off in terms of importance. But I think if it's important to you, it's important to us. But we don't read minds, so you got to bring it to our attention, and hopefully we can bob and weave through this and try to bring you up to a higher, more personal level. Right?
And the level of distress about this issue is the most common among women ages 40 to 65. Not over 65 is a different problem, but 40 to 65 is probably where you're feeling the distress about it. And also that's often where menopause begins.
True. So, let's face it, if things aren't going well in the bedroom, their chances are not going well outside the bedroom. Is that an accurate statement?
That's an accurate statement. It could be a living hell.
Now that's a living hell.
Okay, now we're going to talk more about sex and menopause. The loss of estrogen and testosterone following menopause can lead to changes in a woman's body and sexual drive. Menopausal and postmenopausal women may notice that they're not as easily aroused and they be less sensitive to touching and stroking. This can lead to less interest in sex. What are some of the factors that affect that?
Well, again, we do have a laundry list of things to look at. Check out your television screen and you'll see that things can affect you in terms of the way your bladder is. Some women will have bladder incontinence issues. They may have sleep disturbances. They may have depression or anxiety issues, stress, medications. Again, the list goes on and on. But again, I think that there is perhaps an answer if you ask the question.
Okay, but you have to ask the question. You have to get up the nerve to ask the question, feel safe enough and comfortable enough.
Yeah, and let's face it, when patients come in, I generally feel scrumbaduch, as they say, about asking, how is their personal life? And because it's something that generally is something that should be brought to our attention rather than we ask for it. So we're just as bad. We should be asking the questions as well.
Yes, you are just as bad, and it's often a living hell when we sit there and wait for you to say something. And at that point, we are going to take a break, and we'll be back for the last section already of It's Your Health.
We'll be right back. Welcome back to the third and final segment of It's Your Health. I'm here with my bride. And
it's a happy time.
It's a happy time.
We like doing this with Sammy.
It is enjoyable. And people ask me why I don't go out and shop and things like that. That's because people grab you and say, oh, I saw you on It's Your Health, you and your wife, and it's terrific and this and that. So
no, it's because they grab you and they saw you and they said, I like the way your wife beat you up on It's Your Health. Yes. That's why you don't want to go out
That's
shopping.
That's a very, very often comment. You're absolutely right. But moving right along.
And I'm good at it too. First headline, how do I control stress-induced weight gain? To prevent weight gain during stress and reduce the risk of obesity, get a handle on your stress. When you feel less stressed and more in control of your life, you may find it easier to stick to healthy eating and exercise habits. What are some stress management techniques to combat the stress?
Well, it's pretty hard to avoid stress these days. Let's face it, it's all around us. And what I found since I do the shopping and the cooking and the cleaning,
it's a living hell.
I don't have the if I don't have the temptations, then I won't grab it. For example, I don't buy potato chips and bring them home. So I'm going to buy fruits and vegetables.
He eats them in the car.
So surround yourself with things that are healthy for you, fruits, vegetables, along the like, and keep away the nasty things that will lead to stress eating, because that's a very common thing. We see it when patients, for example, go off to college. They get the freshman 15. They gain 15 pounds because they're eating and stressed out, and they surround themselves with wicked whites, pasta, bread, potatoes, things like that. So surround yourself by things that won't tempt you. That's a good idea, all around.
Mm-hmm. You couldn't do that.
No, that's pretty tough.
Okay, we better go to another headline.
Go ahead.
Is trouble breathing a sign of asthma? Trouble breathing can be a sign of asthma. For many people, the main signs and symptoms of asthma are wheezing, shortness of breath, excess mucus, and chest tightness. For others, A chronic cough that comes and goes every now and then may be the only symptom they have.
Right.
That's my symptom.
It's underdiagnosed and undertreated because we don't think of it. We think of childhood asthma, if you will, where you're actively wheezing. But with the...
My doctor won't check that for me.
Really?
Yeah.
Did you pay your copay, maybe? Maybe if you paid your bill, you might see. But in either event, sometimes with the environment being as crowded with allergens and other pollutants, so we're seeing more and more asthma issues. But keep in mind that reflux, acid indigestion, can sometimes give rise to asthma-like symptoms. And it could be another issue. It could
Now
be,
that's a living hell,
that is,
reflux.
That's horrible. And there's such a thing as cardiac asthma. Believe it or not, you can have a heart condition that would cause wheezing and cough. So you need the proper diagnosis to get the proper treatment.
Next headline is first aid for sprain. Ankle and knee sprains occur most often. Sprained ligaments often swell rapidly and are painful. What are the instructions we should follow?
Think of rice.
Why?
Well, rest, ice, compression, kind of like an ACE bandage, and elevation. So when you see a sprain or feel a sprain, think of rice first.
Okay. And how do you know it's a sprain and you didn't break something?
Well, you don't. If you have bony pain, when you sprain an ankle, for example, the tendon can be so strong that it doesn't break, but it pulls a piece of the bone off where it was attached. Very common. So I think if you have a lot of black and blue stuff, that's a sign that could be underlying damage. If you have bony tenderness, to be on the safe side, go get a picture, get an x-ray of it. But for the initial stuff, rice it.
Rice it. Got it. That's an easy one.
It is.
Okay. Peripartum depression. Early recognition improves outcomes. Depressed pregnant women are more likely to engage in behaviors that pose a risk to the fetus. Depression in pregnancy is associated with adverse pregnancy outcomes, and risk factors for depression in pregnancy, including past episodes of depression, poor social support, unwanted pregnancy, and domestic violence.
Very common, again, underdiagnosed, undertreated. And I can only imagine the lifestyle changes one has as they're progressing through the pregnancy and then delivering, and then everyone's around, and then after 2 weeks they're by themselves with a fussy baby. So it's very common, and you really need to bring it to our attention simply because it really needs to be treated. Poor outcomes for everyone.
You read about that and you hear about that on the news often, bad outcomes.
Right. So that's a tough time.
And here's something else that's tough for a lot of people, chronic fatigue syndrome. It's a complicated disorder characterized by extreme fatigue that can't be explained by any underlying medical condition. The fatigue may worsen with physical or mental activity, but it doesn't improve with rest. What are some symptoms?
Chronic fatigue, in my line of work, is a diagnosis of exclusion. As the name implies, you can get fatigue. Often I see it with sleep disturbance, like a fibromyalgia kind of thing, where they get painful muscles. But also it can affect you in other ways, difficulty concentrating, trouble focusing. Get a load of this list here. You can not only have fatigue, but loss of memory, sore throat, enlarged lymph glands, which suggests perhaps, is this a chronic mono kind of thing? Headaches, unrefreshing sleep, and extreme exhaustion. And then one of the things that I would be concerned about is sleep apnea, because that's certainly underdiagnosed and undertreated, so that may explain some of the symptoms. But again, chronic fatigue is a diagnosis of exclusion. We would exclude other issues like a thyroid or a vitamin deficiency or an anemia or a living hell. That can do it as well. So.
That will do it as well. And this will do it for us. This is our fastest 30 minutes in television, and we've just used it all up.
Thank you for allowing us to come into your home and inform you, and hopefully entertain you. It's Your Health, your leader in healthcare information. Thanks for joining us.